At the Smile Center, we have literally all forms of sedation that are available. Many dental offices will say they do sedation, but actually, sedation is a complicated and varied field, so they may only be doing one type of sedation, where here we do all the forms of sedation. How long you'll be sedated for really depends on which type of sedation that you're having. So the first level of sedation is with nitrous oxide, commonly known as laughing gas. Basically, it's a gas that you breathe in through your nose, and at the same time, you're given a strong amount of oxygen, more than is in the atmosphere, so that it keeps you very healthy. The feeling that you're going to have is that, it's kind of like what we say to children, it's like you're floating through the clouds. For adults, we'll say you're going to feel like you've had one or two beers. The wonderful thing about this level of sedation is it works well for people who have just a minor bit of anxiety, or, for example, they might just have an anxiety about one small part of the procedure, like getting the local anesthetic. Or perhaps they really just don't like the sound of what's going on, so they'd like to be just a little quote-unquote out of it for that. They really don't have any true deep-seated fears. For this, the sedation comes on within a minute. We're able to regulate it, so if someone wants a little more, we can give them a little bit more and then just wait another minute for it to take effect, or if they feel they're a little too high, we can lower it down, and within a minute, the sedative effect is lower. Once we complete the procedure, we then, by stopping giving them the nitrous oxide, and often we'll supplement it with pure oxygen at that point, it's totally out of their system within a minute or two. And so they're able to pick up out of the dental chair, walk out of the dental office, get in the car, and drive right home. Our second level is sedation, often technically called enteral sedation. More commonly, it's known as oral sedation. And here's where, ahead of time, we in our office will give the patient two different pills. Some offices will only use one pill, but we're trying to get a more comprehensive effect. So we'll often give the patient both a narcotic, which reduces pain, obviously. It also makes them sleepy, drowsy, less aware. And then we'll give them a second pill that's a sedative that takes away anxiety and fear. Then on top of that, those take about an hour to take effect, so we give the patient those pills in advance, and so they can take it before they come into the dental office. And then while they're here, what we'll do is we'll layer on top of it the laughing gas or the nitrous oxide. The wonderful effect of this is that we're using 3 agents, and 1 + 1 + 1 in this case does not equal 3, but it more equals 7. We're able to get a much greater effect than if we were just using one agent at a time, and yet each of the agents we're using, we're able to use a lot less because they add to each other and complement each other. For that particular type of sedation, the patient really needs to be escorted to the office because they've already taken the medication before they come here, and they need to be escorted home. And it slowly wears off over the course of the next 24 hours. Lastly, we offer patients IV sedation, and this is where we give the drugs directly into the vein of the patient after they're here. Usually we will place the needle in a vein in their hand because it's just so convenient there. With this level of sedation, which, by the way, I'm qualified to give, but where I am so busy concentrating on doing the other procedures that I bring in a board-certified anesthesiologist that I've worked with for many years, and she is in total control of their life and how they're being sedated and the amount of sedation. So we have someone who is totally monitoring that moment by moment, so we achieve just the perfect effect. For this type of sedation, the patient will absolutely have no memory of what has occurred, they will quote unquote be sleeping through the entire procedure. As soon as it's over, we can, by using other drugs, instantly wake them up, so they can then be sleeping and then wake up with a brand new smile. With this level of sedation, also, it's very important that there be somebody to escort the patient home and stay with them for the first few hours.